So we're going to move on from the application of the short leg stirrup splint to application of the short leg posterior splint. The short leg posterior splint is very universal, can be used for many injuries to the lower extremity. These would include tarsal fractures, metatarsal fractures, fractures to the distal tibia and distal fibula, so you can use them for epiphyseal fractures, Salter-Harris fractures of the distal fibula. You could use it for triplane fractures of the distal tibia or Tillot fractures to temporarily manage the patient in your office setting. This splint is oftentimes used for the classic Jones type fracture of the proximal aspect of the fifth metatarsal bone, because sometimes that fracture just does not heal very well in a splint or reshoe alone. Sometimes those fractures require pinning by the orthopedist in the operating room. So for many metatarsal fractures, you can use simply a cast shoe or a reshoe, but for the Jones fracture of the fifth metatarsal, make sure that patient is not weight bearing and have them placed in the short leg posterior splint. Now, from our previous video, we have part of the splint already applied to our patient, and James is now going to lead us in the final application of the fiberglass for the short leg posterior splint.
Okay, ladies and gentlemen, again, to reiterate about the heel, you do want to pad the heel a little extra because of the chance of pressure ulcers in this area. So you do want to make sure you have a really good padding in the heel to protect that bony prominence right there. Okay. All right. So application of the short leg posterior splint. Again, you want to do a measurement, and your measurement this time will go from the distal end of his first great toe all the way down. Stay close to the limb. Stop just below this bumper here. Okay, guys? Alright, so that's generally the length I need. So we're going to go here. And we're going to do a quick measurement. Okay, generally what I need right here.
We're going to wet this one, right, James, so that
Yeah.
the audience can see how we wet it. We wet generally just one side of the fiberglass. It doesn't matter which side. As long as you wet one of the sides, it will quickly harden. You don't even need that much water. In fact, you'll see James will just put it through once or twice under the sink.
I'm going to show you something, guys, and this is a perfect example. I took a measurement, and that is way too short. This will happen to you sometime. So you have to go back. Take the piece you already cut. Go back to your orthoglass. And you want to cut a couple more inches to get your length, okay? Alright, and that's exactly what I'm going to do. Find your patient, do the measurement, get your little lip. That's the length I need. But like Dr. Leader was mentioning, we need to wet this now.
So I'll just wet one side pretty quick. You don't have to soak it once or twice through the water. I usually will wring it dry a little bit. And then apply it.
Alright, so I'm going to quickly trim my edges again. I can't stress that enough, guys, how you should have a nice clean edge for your patient. And a lot of people ask, well, once you wet this, how long does it take to get hard? You have only a couple minutes. That is it. So once you get this, you want to apply the dry side to the patient. Create your lip. Get your A-strap. Again, I like to secure at the ankle. That way my splint doesn't keep slipping on me.
Just notice how he applied the fiberglass versus how we did the stirrup in the last video. In this one, it went on more like the long leg posterior splint, but just partially up the leg. Remember, the stirrup went on either side of the ankle. This one goes behind the ankle.
Remember, guys, your ace wrap needs to stay below your bumper. The ace wrap should not touch your patient. You can extend this out longer if you need to, or you can, if it's an ankle injury, this is perfectly fine. If it's a foot injury, you can extend it out further. That's the beauty about this splint. And I'm getting Zach very wet here, guys.
I could feel it starting to harden right about now, wouldn't you say, James?
Yes. People always ask too, how hard do you pull on your ace wrap? Well, of course, I'm going to show you an example. You do not pull like this. That is a no-no. That will cause a circulation issue. When you're wrapping, you want it to lay just with a tight, just a little snug. Okay? You should not have any loose fishtails, we call them, within your ace wrap. It should be nice and smooth, but you should never pull on your ace wrap. You don't want that below your bumper, okay? Alright. Okay. There we go.
Remember, these splints are not meant to walk on, so no weight bearing. We're usually pretty firm about teaching the families that the child should not walk on these splints. We mentioned earlier, sometimes we recommend a red wagon or green wagon, depending on which one the family may have. Sometimes we use crutches, sometimes we use walkers, but the take-home message is these are not designed for weight bearing. Follow-up is typically with the orthopedist, usually 5 to 7 days post seeing them in your office. Speak with your local orthopedist to get their ideas and recommendations for follow-up time, but typically a week is usually across the board very reasonable time for making plans for the follow-up for these patients. So we've now reviewed application of the short leg posterior splint, the long leg posterior splint, and the short leg stirrup splint.